Naeem Tahirkheli and Mike Gibson talk to you about the Guardian device. Boy, I've been involved with this device for over 20 years now. It monitors your heart, looks for ST segment elevation. It monitors the direct current right from the heart and alarms you if you're having a heart attack. Got it through the FDA and approved a few years ago. Naeem, how are you using it now in clinical practice?
Mike, just like you, I've been involved with it. You and Dave Holmes were the main folks, and I trained with Dave Holmes at Mayo Clinic, so he invited me over. So this has been going on since 2010. I've been involved with the Guardian device, and I think I'm probably the largest user of the device in the country as we speak, because we were one of the people who got involved in it earlier and saw the utility of it and the usefulness of what it did for our patients. So basically, just like the FDA says, those patients who've had acute coronary syndromes, heart attacks, and are at high risk of having another one. So they're diabetics, or they've had more than one heart attack, or they have multi-vessel disease, or they have renal insufficiency. Those people and some others will have a higher chance of having another heart attack over the course of next 2, 3, 4 years, but especially in the first year or so. And that this thing is the only device that once you put in the heart can reliably tell you that the symptoms that you're feeling could be chest pain, could be arm pain, could be neck pain, could be a silent heart attack. You're sitting there, you don't feel anything, and you're having a heart attack. This thing will tell you you're having a heart attack, and you will get to the emergency room much, much faster.
Yeah, I mean, that's one thing, we saw in the study we did together. There were about 40 silent heart attacks out of 1,000 patients that were detected, well, maybe, in just the one arm. So there's a fair number of silent heart attacks out there. The other thing is, the FDA and others thought, oh my gosh, people are going to be in a rocket sled to the cath lab. But what we found was actually we reduced the number of kind of quote false alarms of symptoms only. So gives you more specificity than you might have with just symptoms alone.
Absolutely, Mike. So, you remember that if you put the Guardian device in the way you guys designed it, and that was part of the process, is you put in the device, and half of the people you turned the alarms off and said, you're just like any other person in the United States who's having a heart attack. These are the symptoms. When you feel like, go to the emergency room. And the other ones, you turned the alarms off. And that's what we tried to figure out which is which. So the ones who had the alarms turned off, so the Guardian device was just sitting there silent, their average time once they had a heart attack, and we won't go into STEMI, non-STEMI, it was about 12 and a half hours, 12.7 hours to be precise, from the time they had the heart attack symptoms to the time they got to the emergency room. And if you had the device turned on, the alarms went on, that was 1.6 hours. That's a dramatic difference. And Mike, you've been leader in cardiology, and you've been around when the Medicare and FDA and all our researchers said, time is muscle. When a person hits the emergency room having a heart attack, you drop everything that you're doing and take them to the cath lab and open the heart artery. The sooner that you open, the higher chance that you will survive and save more muscle. So anywhere in the United States, when you get there, you will have some definitive treatment within 90 minutes. Otherwise, you'll be reporting to Medicare why you did not do that. So we've sorted that thing out very well, thanks to a lot of work that you did. However, the time from home, when you're having a heart attack, to the door of the emergency room is the major problem. And there's no way of solving this other than putting a Guardian device and more education. But the Guardian device makes it simple.
Absolutely. It's so frustrating. We did a great job getting those door to balloon times down, but still people waiting 2 to 3 hours to come into the hospital. So it's so gratifying to see that we might be able to get them in quicker. It's not only reducing mortality. So yes, we want to we want to add years to people's lives, but we also want to add life to their years. And as you're saying, if we can reduce the number of people walking around, perhaps with heart failure, that's also a big advantage as well.
One of the
Right.
added advantages that a lot of people don't recognize is again and again, the spouses, the loved ones, the kids come and they would specifically thank us and say, I can sleep better knowing that they have a guardian device in there. Because once you have a heart attack, you literally have post-traumatic stress disorder. You get a little pinch in your left pinky finger, you're like a heart attack, I'm going to the hospital. And this then gives you that confidence that everything is okay. And if it's not okay, it will let me know. The other thing, of course, the device is doing is the See Doctor alarm, where it is not only just looking for the heart attacks, it is looking for any other problem that might be occurring. So the heart rate starts to go fast, the heart rate goes slow. You have atrial fibrillation and PVCs. These are technical terms some of the people may not understand, but generally, if there is rhythm abnormalities, it will alarm and make you go to the doctor. And then we can look at the strips and say, well, this is what you're having, and this is what we need to mitigate that and stuff. So a really useful device to have there. The name has been extremely apt. Guardian device. It literally is your guardian.
We did have some quality of life data that you know all too well, that people do feel less stressed knowing that they're going to be alarmed if something happens. I think one of the quotes from the patients was, "It feels like I'm still kind of being monitored by the ICU. I feel like I'm safe." So that's also very important, as you point out, Naeem. Well, Naeem,
90%, 90% reported improved quality of life because of it in that paper.
exactly. Well, Naeem, thank you so much for chatting today. Glad the device is working well for you in practice. I look forward to following up with you again in the future.
Thank you, Mike.
Thank you,
Take
and
care.
thanks for everyone for joining us.
You bet.